One of the problems that a lot of women face in India is fibroids, and there are many women who undergo surgery for fibroids. A lot of them also take medicines. Some of the women take alternative therapies, and fibroids is something that is very commonly seen and done by a lot of gynecologists in India and across the world. So, a lot of the times when a patient comes in and she's obviously probably seen another gynecologist and or the general practitioner, and they've advised her a sonography, and a fibroid is seen or is written down on that sonography by the radiologist, and then eventually she comes to a gynecologist, and she always asks us, what is this, why do I have this, and what can be done about it. So it's a lot of the decision making by the gynecologist is taking into account a lot of factors. One of them is, of course, her age. The second is whether she plans to conceive. The third is if she is old enough, is she okay if we remove the uterus? Other factors like, is this a fibroid for sure, or does it look like something else? Is it suspicious for a malignancy? So all these factors really play a role in our decision making and giving the patient the best advice possible for her. Now, a lot of women, when they come in, they ask, how can I get it removed? Some of them have tried medicines, and there are some hormonal tablets which are available. They give temporary reduction or temporary relief from symptoms, but eventually the symptoms come around. Usually the symptoms are like pain or excessive bleeding, and the patient has tried medicines, or some of them just outright want to get it out. So how can this surgery be done? So there are a number of ways where one can remove a fibroid or try and shrink a fibroid. One of the ways, non-invasive ways, is uterine embolization. We commonly insert a catheter in one of the arteries, and we try and block the feeding vessel to that fibroid. So once you block that vessel, the fibroid doesn't have any blood supply and shrinks in size. Now this is, of course, temporary. It is not a permanent solution, and one must remember that even if we shrink or take out fibroids, there is a chance that a fibroid might occur from another cell in the uterus. Remember, these fibroids arise from cells which are normally there in the uterus. These are smooth muscle cells, and they eventually grow into a mass called a fibroid. Now, what is the next option? The next option, of course, is a surgery, and we'll come to minimally invasive surgery because this is one of the most commonly performed operations now across the world, and it is called as a laparoscopic fibroid removal, and it is done at most centers in India and abroad. So during laparoscopy, what should one expect is a question that is asked. And during laparoscopy, it's very easy. One is on a liquid diet the previous day. One takes a bowel evacuation tablets. We call them Dulcolax or any other enema, to clear the bowel, to make the visual field very clear for the surgeon. And then during laparoscopy, a woman is admitted in the morning. The procedure is performed. It usually takes maybe even half an hour, 1 hour, sometimes a little longer. And then by the same day, the woman goes home and can rest at home for a few days before returning to work. On the day of the surgery, there are certain pre-medications which are given, blood tests which are done on the day prior, and then on the operation table itself, the anesthetist assesses the patient, puts in a camera. A camera is put in by the surgeon, and the fibroid is removed. Once the fibroid is removed, that fibroid is morcellated, or it is basically chewed up by an instrument, and this fibroid material is sent for testing. We then close whatever incisions we have made, and then shift the patient to the recovery room. The next question which is asked is, especially in the younger women or the younger population, usually asked, I really want to get pregnant and now I've had my surgery. When can I start trying for a pregnancy? So depending upon the extent of this fibroid, we usually advise give it at least a couple of months, maybe 4-6 weeks, sometimes 8 weeks, to really see to try for pregnancy. Of course, this depends on a number of factors. If the number of eggs in the woman is less, we would try and go for an IVF. Sometimes if the husband's sperm count is very low, or there aren't enough viable sperms, we'll have to go for some assisted reproduction techniques. So this depends on a lot of factors, and it is not just the same for every woman who undergoes surgery. We now come to the second type of surgery, or how to remove a fibroid, and that is by the vaginal route. The vaginal route is a natural orifice, and a large amount of surgeries, a large amount of hysterectomies can be done even vaginally. The uterus can be removed with the fibroids, and this is usually reserved for women when they have finished their childbearing or do not wish to conceive, especially in women in the menopausal age group. So in this, the uterus is removed and the entire surgery is done without an incision on the tummy. Now the third method, which is now very less frequently performed, is by an abdominal myomectomy. Now in an abdominal myomectomy, when can we do it? We will make a fairly large incision. Sometimes it's small, but usually it is a substantial incision across the tummy. And it's really done with very, very large, complicated fibroids, which of course one can undergo laparoscopy, but laparoscopy in these complicated, very enlarged fibroids, where there is a suspicion also for malignancy, is very difficult to perform, very time consuming, and there are much more chances of certain complications to other structures that can occur. So this fairly large fibroid, sometimes it's like a football in size, can be done by an open surgery very safely, and this is sent for testing to the histopathology lab. So these are the three ways in which a fibroid can be removed surgically: the minimally invasive way, the vaginal route, and by the abdominal or the open surgical route.